Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's Zoom news conference for the latest in COVID-19 information. Let me go ahead and quickly introduce who is on our panel today. We're joined by Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Todd Bell, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We're going to get open up to our medical professionals to make statements, and then we'll take questions from our media here in attendance. We'll start with Casey Stoughton. Casey, how are you today?
I am good. I am coming to you from a very busy public health department. So we are giving back to school vaccines as well as COVID boosters for people who are in that, moderate to severe immunocompromised immune system status. And so it is a very busy public health department today. So you may hear my phone ringing, you may hear me getting texts, all sorts of things happening today. We're testing, anywhere from 30 to 50 people a day through our public health department as well. So certainly a busy day here at Public Health, doing lots of good work. Always want to support our medical community as this surge continues. So want to certainly send our support and good wishes out to our medical community. We'll talk about numbers and then certainly give you more information about how you can see if you qualify for that booster dose. As of yesterday, there are a total of 38,235 cases of COVID-19 in Potter and Randall counties. We have 2,877 active cases currently, and we're up to 792 deaths. So we're certainly seeing that increasing trend continue here in our community. The 5-day new case average has risen to 225 new cases per day. And we're increased testing, like I said, testing upwards of 50 to 55 patients a day. We will have an increased number of cases reported on our 230 report card. We will remain in level red for another week, as we have 3 of the 4 metrics that are in level red. We will reevaluate the data and either stay in level red or move to level orange next week. So more to come there. Yesterday, our GA34's hospitalization percentage was at 15.51%. So yesterday was our first day over that 15% mark. So if we have 7 consecutive days over 15%, we'll be considered an area of high hospitalization. We're certainly an area of high transmission. So masking, vaccination, social distancing, quarantining, if you've been exposed, so important. But more to come on if we move into that area of high hospitalization. Like I said this morning, we began giving 3rd doses of the Moderna and Pfizer vaccine to those with a severe or moderate immunocompromised status. On Amarillo alerts, there's a list of conditions that you can check to see if you might be in that category, or if your physician recommends that you get that dose based on your immune system, then please come see us. We're giving the vaccines at the building next door to our main public health department. It's also our building that we have that we own at Public Health. So that's at 850 Martin Road. So right next door to Public Health. Please come see us. COVID testing is still available. Call 378-6300 to be screened and directed to the test site. And one other announcement, Texas Tech is providing a town hall kind of question and answer session at noon today. It's virtual, so on Zoom. So please tune into that. More information is on Zoom. They're partnering with KAMR to provide that wonderful resource. So if you've got questions about COVID, if you've got questions about the vaccine, please tune in to that, and you'll have wonderful information there and an opportunity to ask great questions. So check that out. That's all I have today, Dave.
Thank you, Casey. Let's now go to Dr. Todd Bell, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Bell, how are you?
I'm doing well, thank you. So just a reminder to everybody that this surge is not over. As a matter of fact, this surge is, we think, just getting started. Schools have opened up. We're all glad to be able to see the kids back in school. We know that this is going to be something that increases our transmission rate in the community. I think that one of the things that we've discovered over the course of this pandemic, and certainly in the past month or two, is the supreme importance of personal responsibility. The fact that if somebody is infected, if somebody has symptoms, they don't need to go to work or school. They need to be tested. If somebody has exposure to an individual, don't wait for the health department or someone else to tell you what the right thing to do is. If you know that you have an exposure to somebody with COVID, then if you have a family member who has COVID, then you need to quarantine unless you're vaccinated. And so those unvaccinated folks with exposures, they need to be able to stay at home, stay out of the school. Don't wait for some official to be able to tell you what the right thing to do is. We need as a community to know what the right thing to do is. I would say that if people have questions, if they're not certain whether they've had an exposure or not, or if they've had an exposure and they're not sure how long they should quarantine, please call the health department. We're happy to be able to work through that with you. With school starting, the process of quarantine is not going to be an easy one. There's not going to be folks who are going to be calling you, telling you that your child 6 hours after they were exposed needs to be quarantined. That's just not happening. And so we need to be able to take responsibility as individuals, as community members, take care of our neighbors by taking care of ourselves. I would also, of course, encourage those folks who are unvaccinated to get vaccinated. If you're a high school kid and you want to play football and you don't want to get stuck being quarantined because of an exposure, well, you need to get vaccinated, because the only way that we're going to for sure be able to avoid quarantine is based off the current data. We don't have to quarantine people that are vaccinated. We want people to wear masks. Again, this is something that no government official is going to be able to mandate that you wear a mask outside of a healthcare facility. Doesn't mean it's not the right thing to do. No government official is going to tell you that you shouldn't dance around in a thunderstorm with a 10-foot metal pole, but it's the right thing to avoid. You don't go dancing around in a thunderstorm because you know that that's silly. We need to avoid this virus, not because somebody's telling us that we have to, but because it's the right thing to do. So I would just implore all of us as a community, as neighbors, as friends, we've got to pull together to be able to do the right thing to get this virus tamped down and be able to make it through this.
Thank you, Dr. Bell. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Good morning, Dave. Well, I'm saddened. Over the last 24 hours, we had 3 individuals in our hospital lose their lives to the virus that causes COVID-19. That brings us to a total of 8 people that have passed away since August 1st from this virus. Now, unfortunately, all 8 of these people did not receive the vaccine. And I do believe that had they had the protection of the vaccine, those outcomes would be very different. Yeah, I wanted to offer an analogy. So imagine our immune systems are like a guard in a bank. If that guard is told, hey, at some point in the future, this bank is going to be robbed. If that's all the guard knows, then every person that walks into that bank becomes a suspect. And it'd be very unlikely that that guard would recognize what's going on until the crime is already in progress. What the vaccines do for our immune system is equivalent to if we gave that guard a photograph and said, that's what the suspect looks like. That way, the minute that suspect walks into the bank, that guard can respond instantly and hopefully prevent all the drama that would have otherwise ensued. That is what these vaccines do for our immune system. They teach our immune system what this virus looks like. So the minute it enters the body, the virus can respond to it and hopefully prevent all the drama that would have happened if that virus was allowed to basically use our bodies. So please get the vaccine. I think that's so important to allow that rapid response. Let's talk about the numbers at Northwest. So we have 46 COVID positive patients in the hospital today. Now, I can assure you that all 46 of those are probably Delta variant infections. We also know that all 46 of those patients have not received the vaccine up to this point. Now, that is 9.3% of our licensed beds, but that is 21% of all the patients we currently have in the hospital. Again, our capacity is somewhat limited by our nursing staffing shortage. Now, right now, out of those 46 positive patients, 22 of them are in the critical care unit. We are using 17 ventilators total, 11 of which are needed by the patients who are suffering from COVID. Now, yesterday we did 209 outpatient tests, and 14% of those came back positive for COVID-19. This has been consistent with what we've been seeing for the last 3 to 4 weeks. Is we've always been around 15% or higher in terms of our percentage of positive tests out of the total ones we check. Now, and we talked a lot about the fact that we have this limited capacity from a nursing shortage. Today, we had 8 holds in our emergency room. That's the best we've been in a while. And these are 8 people who are stuck in the emergency room waiting for a bed to come available because of our nursing shortage. Now, at the same time, to remind you, we know that there are 34 patients out in the regional hospitals, these small, very good community hospitals, but they're trying to get these patients to a higher level of care. There's 34 patients waiting in these hospitals, 25 of which need a critical care bed, 17 of which have COVID that need that critical care bed. So this is part of the challenge is we want to help these facilities, but as long as we continue to struggle with our own capacity, it really makes it very difficult for us to be able to bring these patients to a higher level of care in Amarillo. One last thing is we are offering Regeneron. This is the outpatient antibodies that we're using to try to prevent someone from being hospitalized early on. The FDA loosened the requirements to receive Regeneron. If you think that you may qualify for that and are positive for COVID-19, please contact your physician, and they can help get you to either us or BSA or any of the other sites where Regeneron is being used to hopefully try to give you that infusion and prevent you from getting sick. I leave with say, please keep yourself safe. If you get the vaccine, you're protecting yourself. If you wear a mask, you're protecting everyone around you. And as Dr. Bell said, we have to do both at this point to stop this surge. So please keep your distance, wear masks, use the hand hygiene, and let's shut this virus down as quickly as possible. Thank you very much.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Thank you. Good morning. Good morning, Amarillo. I think that the comments made thus far this morning are spot on in terms of what the concerns are and kind of where we are with this rising number of COVID cases again, unfortunately, in our community. Today at BSA, we have 78 patients hospitalized. That number continues to climb in a disturbing fashion. I believe last week when I was on with the rest of our comrades here, I was reporting our numbers were in the low 50s at that time in terms of hospitalized patients. So you can see in a very short period of time here, we've now jumped to 78 hospitalized patients, which is very concerning. Out of those 78, 32 of those patients are in the intensive care unit. And of those 32 patients in the intensive care unit, 22 are on the ventilator at this time. We've also been having very high numbers of patients come through our respiratory triage area, anywhere from 35 to in the low 50s per day of folks coming in with respiratory symptoms. Not all of those turn out to be COVID-19, but many of them are. And we're seeing that this number is continuing to be a high volume with that type of symptomatology coming through our ER. We unfortunately have 34 of our staff now quarantined for either COVID infection or exposure. And some of those staff members have been vaccinated that are now under quarantine. Fortunately, none of those that have been vaccinated that have gotten infected or exposed have needed hospitalization. Most all of them have had a very mild infection, and we're taking precautions per CDC guidelines and keeping them quarantined. We're using 26 of our 45 ventilators at this time. And this morning, we're using 46 of our 48 ICU beds. Only 2 ICU beds were open. Because of some of the support staff that we received from the RAC, and we got 5 RAC nurses and 9 respiratory therapists this week, which was a very, very nice blessing for us to have. And we also currently have 43 travel nurses that we were able to obtain with our own recruiting efforts over the past months. We were able to have that number of travel nurses here to help us keep our beds open. But we have had it closed, as I mentioned, intermediate care unit now for almost 2 weeks. And today we were able to open up 8 beds in that unit. That is a 30-bed unit. So we still cannot open that up fully, but it's going to allow us to hopefully decompress some of our intensive care unit volume, which gives us a little bit more flexibility, but it is not good we're having to now creep into our other intensive care units with COVID patients because of that growing number in the ICU. And it is quite concerning, as I mentioned previously. Just to make sure we have some additional statistics here, of all the patients that we have admitted today at this time, 87% of them are not vaccinated. Again, 87% of the people in the BSA hospital today with COVID-19 as their primary diagnosis are not vaccinated. We're seeing that the vaccinated folks that do get infected, most of them tend to have much more mild presentations. Some of them, unfortunately, not. Everybody that has their own unique genetic makeup and immune response obviously is part of the reason why some folks, even with vaccination, are succumbing to this virus. And I think it's important for us to know that what we've seen as far as any levels of protection, the best thing to do is to get vaccinated. The next best thing to do is to take some of those blocking and tackling measures that we know help to diminish the risk of transmission. And that's masking, that's attempting to social distance, and to be very conscious about hand hygiene and being very conscious about being around individuals that are having symptomatology of any kind of a respiratory infection, coughing, sneezing, things like that, because it's just unknown whether or not that's the simple cold virus or it could be COVID-19. And you need to be worried about that, especially if you're not vaccinated. I think the other thing that I'll state statistic-wise is that a little bit higher numbers than what Dr. Weiss's team is seeing. We have 20% month to date of all of our tests coming back that are positive. And that is a concerning number. As I mentioned last week, that number is higher than we had in December of last year. And it's second only to November, when a third of the tests that we were doing at that time were all coming back positive. And for whatever reason, what we've seen so far with this Delta variant in terms of the severity of illness, in terms of the risk for severe complications, we are seeing a significant number of patients succumb to this virus. And it pains me to say as well that we've had 13 deaths since the middle of August in our hospital because of COVID-19. And again, I can't talk about further details of that, but I want to just convey the severity, which is that people are dying in the hospital of COVID-19. Dr. Weiss has been telling you that for a long time. We've been seeing these numbers, unfortunately, as well, and it is very concerning to us. And this is despite giving full press measures, we call them, in terms of all the drugs we have at our disposal, all the supportive care, the best care from physicians that are in our community, covering both hospitals that do an outstanding job of managing these patients in terms of supportive measures. It's not good enough when you get a severe infection because this virus is so devastating, and we need to be worried about it. And the last thing I'll say is that the booster vaccinations, I think, are critical. I think we're going to probably hear pretty soon that they're going to be eligible for healthcare workers. We already know they were approved last week for those with severe immunocompromising conditions. That's not a lot of our population, but it is individuals that are high risk, and those folks would need to strongly consider getting vaccinated with a third booster dose. We probably will see something coming as a recommendation from our government regarding healthcare workers, which we believe is a good idea in terms of trying to protect our staff and to keep that staff healthy and protected to continue to care for patients that get sick with COVID-19. So more to come on that. And hopefully we're going to have that availability of vaccine to vaccinate those healthcare workers when that has come. And the last thing I'll say is that there are other countries in the world that are doing much better job than we are with vaccination rates. And those countries have been able to stave off the COVID virus better than us. In some of those countries now, because the Delta variant is so pervasive, they're starting to see higher numbers of patients get infected. And I think this just suggests that we have such a difficult virus to combat that if you don't have a minimum level of immunity against this infection, your risk for a severe complication is extremely high, no matter what your age is. We have pediatric patients hospitalized now. We have patients that are in our labor and delivery unit, moms that are positive. And the people that we have in the hospital now, that are infected, most of them are less than 60 years of age. So again, think about that when you're thinking about your personal reasons why you may not have been vaccinated to this point. That's all I have today. Thank you, David.
Thank you, Dr. Lemonier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. So I'll start out with our numbers. Currently, we have 2 COVID patients, both in the ICU, one of which is on the ventilator. Now, as with everyone here, encourage all of our veterans to be vaccinated, their caregivers, their dependents, anyone. If you are eligible to receive a vaccine, which is pretty much anyone over adolescent age and above, encourage you to be vaccinated. We are seeing that our veterans are getting vaccinated. Still would like to see that percentage higher. We're right about 50% of our veterans vaccinated that are within our enrollment. We do have the vaccinations available, and we are doing the 3rd dose booster vaccination for those that are eligible, for those moderate or severely immunocompromised. The one thing I want to say, because of the way we have to do that, is those patients need to schedule an appointment. So if they call us at 806-355-9703, hit option 2, and schedule an appointment, we would absolutely be able to set them up for that booster vaccination for the Moderna. Once again, that's the one we have is Moderna, and then we have the J&J. The other thing I want to mention while I have the opportunity here is most of us have been watching in the media what's going on in Afghanistan, and that is impacting our veterans, not just those that have been to Afghanistan, but those that have deployed as part of the war on terrorism, and also on part of even Vietnam, where often some of these conditions are being related to. And so we just want to remind our veterans, please reach out to us. There are many resources. I know I'm a veteran myself, and I got the email from the VA with multiple links to resources. Just encourage, please call our behavioral health if you need some assistance, 806-355-9703, option 2. And I do want to remind all of our veterans of the Veteran Crisis Line also. Another resource they can call. This is 24/7. That number is 1-800-273-8255. And so that's all I have. I'd like to thank the city of Amarillo and appreciate you for allowing me to throw that on while I know this is supposed to be focused on COVID. Thank you, David.
Thank you, Dr. Gonzalez. Let's now go to the City Manager, Jared Miller. Mr. Miller, how are you?
I'm good, Dave. Thank you. I wanted to take just a very brief moment to point out that we are going to be making operational adjustments to how we provide services here in the city of Amarillo, just in response to our current level red condition and our elevating hospitalization rate. The purpose of that is to mitigate and manage face-to-face interactions so that we can limit the spread while still providing all services. We're not going to discontinue any services. There will be service impacts in some facilities, but that will be managed through curbside services in certain situations, just so we can, like I said, manage those face-to-face interactions. I do want to emphasize, though, that we are going to continue to provide all services just with appropriate safeguards in place. We're going to work to make sure that we can keep our community safe, our staff safe as they're working together, and also make sure that we can maintain our ability to provide essential and critical services, whether it be public safety through police and fire, making sure that they have the ability to respond when called, making sure that our call takers have the ability to take that 911 call when they get it, and making sure that the rest of our team has the ability to provide all of the other very essential services they provide, whether they're water, wastewater, or recreational services. We do not, at this time, anticipate any reductions in outdoor sports field utilization or anything like that, or at the Civic Center. However, we will continue to facilitate safe events to take place, providing all encouragement, all signage necessary to help patrons know where they can go to get a face covering, places they can go to get tests and vaccinations, and all the other information that the doctors have been talking about. Did want to make sure that everyone knew that we were going to have some service impacts, but they were all going to be very measured in their approach and how they're applied. And you should be very familiar with them throughout how we've handled the last year of coronavirus. Also, we are currently working under the Executive Order GA 38. While we do still track the hospitalization rate, it is very much a representation of hospital capacity at this point. There will be no community impacts as far as occupancy rates or anything like that if we reach 7 days consecutively above 15% hospitalization rate as defined in GA 34. So also wanted to make sure that there will be no impacts to the community unless there's changes to governor's executive orders and directions from the Texas Department of Emergency Management, Department of State Health Services, or from the governor. That's all I have, Dave. I'd be glad to answer any questions at this point.
Thank you, Jared. We'll now go to members of our media who are in attendance. We have a question for individual panel member or the panel as a whole. That's completely fine. Let's start with Kevin Welch of KFDA News Channel 10. Kevin, how are you? We'll go ahead and start with Kevin Welch of KFDA News Channel 10. Kevin, how are you? We will come back to Kevin. Let's go to Dalton Williams of KVII Channel 7. Dalton, how are you?
Good morning. I'm good. David, can you all hear me?
Yes, we can.
Okay, perfect. So my first question is for Dr. Weiss. You touched a little bit on the nursing shortage and everything that y'all are experiencing. How can you go into a little bit more in depth on how the hospital is coping with that shortage?
So, Dalton, Dr. Lematier is commenting a lot of what we're doing too. So, really severalfold. First, we are working with some agencies to try to bring in traveling nurses, and we've had some limited success with that. Clearly, we've put in a request to the state and to FEMA for also nurses. Now, what I was told is that with regard to the RAC or the state nurses, that there were about 92 nurses coming that would have to be shared amongst the two main hospitals in Amarillo and the two in Lubbock. So I really don't know exactly what numbers we'll get there, but that's always welcome news that at least we're getting some help there. And then third, we've been working on incentivizing our own nursing staff to maybe take some extra shifts. And so we lost a lot of nurses that went traveling around the country last year, obviously because there was a lot of rewards with regard to the money they could make in those positions. So what we're doing now is saying, well, if you'd like to work extra time like you would if you were traveling, then please stay here and we will reimburse you for that. So we've come up with a plan to help reimburse those nurses for extra shifts and extra work they're doing.
Okay, and then
well, Dave also, or Dalton also, the city and emergency management and Texas Department of Emergency Management are working with our hospitals to request additional staffing. As we've heard throughout this most recent escalation in case numbers, staffing is under an enormous amount of pressure. But the state has been working to secure personnel. I received word this morning that through the work with the trauma service areas, Texas Department of Emergency Management, trauma service areas A and B, which is Amarillo and Lubbock and all of the surrounding hospitals and counties, will be receiving 92 additional contract staff. That'll be distributed equally between the four major facilities in those regions. We will have, it looks like over 20 staff members being distributed to each of the hospitals, not exactly the same numbers to each hospital, and I don't know exactly the rationale for how they distribute those personnel, but we're looking for possibly more next week. I know the state is putting all their effort into making sure they can provide the staff, all staff possible, so we're working to facilitate those efforts as well. And doctors, y'all may not have even seen that information yet. It is very fresh, but.
Okay, and then my next question is how, for either of any of the doctors on this panel, how is the morale at your hospital? Like, how are the nurses handling all of this?
I can start there. Yeah, I would say that the morale is certainly suffering. I mean, obviously, we have folks that are working lots of hours. We have folks that are putting themselves at risk every day, caring for patients that have COVID-19, in addition to many other patients that have other significant and severe illnesses that are oftentimes difficult to manage and exhausting in terms of that ongoing need for more support. As Dr. Weiss mentioned, we are asking folks if they're able to work extra shifts. We are working on and have been providing additional compensation to do that, to certainly make it worth their while to do that. But there's only so much you can ask from someone who's worked many shifts in a row. It's exhausting physically and mentally. And again, I think all of the healthcare providers on this call have been there themselves in their careers. When you're working that many hours, it is very taxing on you and also your families. And I think that affects morale adversely. And then when we see individuals that continue to come into the hospital and are having severe consequences of COVID, and they're not taking the personal accountability and responsibility to get vaccinated, and they end up taxing the healthcare system, it's frustrating because we know there's a method by which we can prevent this illness from causing such severe disease, and the vaccine is the tool to do that. Millions of people have been vaccinated and have been vaccinated safely. And again, it's a situation where if we had more folks doing that, I think we'd be in a much better situation than we are in right now.
Yeah, I would certainly concur with everything Dr. Lamentier said. I think, unfortunately, this summer was a bit of a teaser. We got down to such low numbers, and we were allowing visitors to come back into the hospital. And here we are now, we've had to restrict visitation. So that even adds further burden to these nurses that are already exhausted, because now they're kind of the surrogate family members for these patients who cannot receive visitors. So we're struggling with morale. We have nurses that this is round number 4 for them with this virus, and that is tough to deal with. So we're doing everything we can to try to maintain that morale, but it's tough going for them.
I think one thing that's interesting to add, I have a family member who is a physician in another part of the state. The way he phrased it was talking about the morale in the hospital, because it's the exact question we were talking about earlier this week. He said it's like they're treating an entire hospital full of critical car crash victims, and none of them are wearing seatbelts. It's hard to see, and the only thing I could tell him was keep your heads up, keep you and your team's head up. We need you. They need you. So it's a hard story.
Okay, and then that's all my questions. Thank you all so much for having me, and I hope you all have a great rest of your day. Thank you.
Thank you, Dalton. Let's now go to David Gay at the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. My first question is, federal officials announced today regarding an expansion of the potential expansion of COVID-19 booster shots coming this September. With that announcement, have there been conversations at the city level, Casey, regarding plans to go back and expand the city's vaccination clinic with more people getting with the potential of getting those booster shots?
So, no, I mean, the announcement has just come out. So, we're responding to our current situation. And the nice thing about our plan at the Civic Center is we can stand that up pretty quickly. And so we'll be able to respond to that very quickly once it has approval through the system. So we have to have approval from the FDA and the CDC, and so we'll wait for that approval. But our plan is a good plan at the Civic Center, and we can stand that up very, very quickly in the event that we need it. We also have a wide supply of vaccine here in our community. So pharmacies, doctors' offices, there's a lot of vaccine out here in our community. So I don't know that we'll have the need for quite as big an operation as we did in December, January, February, because there is such a wide distribution of vaccine, but we have the ability to stand that up if we need it.
Absolutely. And just follow up on that. Obviously, you spoke a little bit about the booster shots beginning today. Can you tell us, I guess, how many people have taken advantage so far this morning?
I can't. I'll have to, check with the team on that. But I can tell you the parking lot was full, and so it's good to see a full parking lot.
Absolutely. My next question is for Dr. Weiss. You spoke a little bit about the Regeneron treatment and how there are some loosened requirements for that treatment. I guess, can you talk to us a little bit about some of those loosened requirements, and does that, I guess, expand the eligibility for folks to take advantage of getting that treatment?
right? Well, I think the biggest one, David, is the Regeneron, as well as all these other monoclonal antibodies, are really meant for people at higher risk for getting sick from the virus. So people either elderly with medical problems that make them higher risk. I think the big change was now the Regeneron is they've said you don't necessarily have to be positive for the virus, but you have to have had a high risk exposure. So if you're a high risk patient with a high risk exposure, now that allows us to be able to provide that infusion for you. So, if someone comes, I know we're giving it at one of our freestanding emergency rooms at Town Square, and I believe Dr. Lamentier's team is giving it at their urgent care. But if they come to one of those locations, they will have to go through a questionnaire that makes sure that they are eligible for that particular infusion. But that's been the newest one is you don't necessarily have to be positive, but you do have to have a high risk exposure.
And I guess for Dr. Weiss and Dr. Lementier, has that increased, I guess, the demand for that treatment in the community?
Yeah, you're going to the perfect place, David. That's a good segue. That's where I was going to chime in here and say. So I have an interesting statistic for you. We obviously have been, as Dr. Weiss mentioned, we're giving lots of Regeneron at our BSA urgent care clinic, and that is on 45th and Bell. And you can get scheduled for Regeneron there by getting a doctor's order. So from your primary care physician or another physician that you see for care, you can get set up for Regeneron if you meet criteria. But just to put this into perspective, this month of August, we have had a tremendous number of infusions completed with Regeneron for COVID-19. Our highest month of infusions was back in January of this year. At the time, we were using that bamlanivimab, the first monoclonal antibody that was available. In that month of January, we gave 160 some odd treatments with bamlanivimab. In August, through half of the month, we have just about caught that number. We were in the high 150s of number of infusions, 158. So in just about 2 weeks, we've almost caught up to our entire month of January's infusions, which was our worst month since the outset of the pandemic. So we have a lot more demand for the drug. A small portion of those are on the expanded indication. So most of these are people are infected and they meet criteria. The good news is when you get that therapy, there's a significant impact on preventing a hospitalization and maybe saving your life when you get that therapy because you avoid a severe infection. But certainly that demand is going up. We are getting additional allocations of Regeneron. We're hoping that our allocations increase for the drug because the demand is going up. We're giving about 20 infusions a day now through our urgent care clinic, which is a significant number. So the burn rate is going to adversely impact our quantity, but the good news is we're getting it administered. And then the other sobering statistic that I'd like to mention is that across the Ardent Health System, we're part of the Ardent Health System, which is 30 hospitals across the country. Most of our hospitals are in the South Central US, Texas, Northwest where we are, East Texas in the Tyler region, also Oklahoma, Albuquerque. Those are where most of our hospitals are. We went from a week ago in our system having about 150 patients hospitalized for COVID-19. We're now up to 500 in our system. It's very concerning. And these areas are certainly areas where we have lower capture on vaccinations. Our markets in New Jersey are having very few patients that are hospitalized now for COVID-19, and they have a very high capture rate with vaccination.
Absolutely. Absolutely. Thank you for that. I guess my last question is for Mr. Miller. I know that you talked a little bit about various city services being impacted. I know that last week during city council, there was some talk about moving the meeting to be a virtual meeting. Are there any impacts on, I guess, hosting public meetings in general, including city council next week in a virtual fashion?
No, they're not. The ability to do virtual meetings goes away at the end of August. So there's really no point in going back to virtual for one meeting. All meetings that are subject to the Open Meetings Act will need to be in person. We will work to find alternate locations that will provide the ability for more distancing of both council or board and commission members, and also of any attendees. So we're looking at some bigger venues to do our meetings going forward, at least until we get to a point where we're not such an area of high transmission for Delta and for COVID.
Absolutely. That's all the questions I have. Thank you, guys. Have a good rest of y'all's week.
Thank you, David. Let's now go to Aaron Langston at KMR Channel 4. Aaron, how are you?
Doing good. How are you?
Fine. Go ahead.
First question is, we're hearing that a number of COVID positive patients are showing up at your freestanding ERs and the urgent cares and whatever the title they are. And because of the strains at the main hospitals, they're having to stay there. Do you have any information on how many patients you have in your systems around town that you just don't have room for at the main hospitals?
Aaron, I would say, so you're absolutely right. Patients who are COVID positive are coming from every direction, coming through, just about every approach to the hospital, FEDs, urgent cares. We are doing our best not to hold patients in those peripheral facilities. Right? If someone is sick enough to be hospitalized with COVID-19, they really need to come to the main hospital where we have, many more resources and ability to respond to their needs quickly if need be. So right now, we're not holding any patients in our emergency rooms, our freestanding emergency rooms, and just trying to get them to the main, where we do have to have them hold at times in the main emergency room.
Yes, and I would say that that's true for us as well. We have had a couple, yesterday we had a couple patients at one of the local freestanding ERs that were headed for BSA. We accepted them, but they were on a waiting list and they were waiting to come to us, and they were COVID positive. That was 2 patients yesterday. I would also say that this morning we had 27 patients holding in our ER for admission. That is an extremely high number for us. That is not normal for BSA. And of those patients that were waiting, there was a portion of them obviously that were COVID patients, but it's also affecting those that are not COVID patients that need healthcare for other acute medical problems. So this is having, as I mentioned before, a significant impact on our healthcare capabilities because we don't have the staffing to augment our capacity to its fullest extent.
All righty. And in the past, you've talked about once a patient went on the vent previously with COVID, that was a very bad sign for the outcome of that patient. We're hearing now that getting on the vent early might help these patients. Is that the case of what you're seeing now?
I would comment that there's no real change that we're seeing at all. If anything, I'm concerned about the Delta variant causing a worse hospitalization course for patients that have severe disease. And we still know that if you get on the ventilator with COVID-19, your prognosis is very poor. Again, historically, we've said it's a coin toss, 50-50 in terms of your mortality rate if you get on the ventilator. I don't know that it's that high still, but it's close. And I would say that there should be no suggestion that someone who gets COVID-19 and has severe disease that goes on the ventilator, that we should feel good about the prognosis. We should not feel good. We should be very worried.
All righty. And Mr. Miller, you was talking about changes with the city. Will there be any changes for first responders, police, fire, such as that, as there was initially, the mask and some of the steps taken to protect them?
They're going to be taken. It's all going to be very reasonable operational things. Wearing the face coverings when appropriate, changing possibly the location where you do interviews, maybe going outside or other locations where you have lower probability of transmission if you have to have an extended meeting. It's a number of operational things like that. Nothing that they're not used to or that will be a challenge for them. I think the plan that I'm looking at right now is very detailed from both the fire department and the police department. And this was proposed through operational meetings that they've been holding this week. So I anticipate we're going to have no problems implementing those. They are going to be reasonable accommodations that they're going to have to make, recognizing the challenges that we have with Delta, and also with just the need for them to remain a viable operational group. So there will need to be some changes that will just mitigate the face-to-face contact, manage those face-to-face interactions, but still while providing all services.
All righty. I think that has to be covered. Thank you very much.
Thank you, Aaron. Let's now go back to Kevin Welch of KFDA News Channel 10. Kevin, how are you?
I'm good, Dave. Thank you. Say, Casey, I guess I've had several phone calls, people asking, do they need to bring some kind of documentation to get booster shots? How does that work?
No, that would be by just patient attestation. So they just need to let us know that they fall into that category.
And what about the hospital doctors? Do y'all require anything like that? Doctor's note, something?
For the VA, obviously, if it's a veteran, we have access to their records, but for our caregivers and employees, we just, same thing as self-attestation.
Okay.
At this time, we have not started the booster vaccinations yet at the hospital. We plan to do so for our employees and our medical staff members. Again, we're going to need to work with what we can do with supply in terms of the right type of vaccine for individuals. The preference is to give folks the same vaccine they had originally. And right now, we have predominantly one vaccine in our inventory.
Yeah, Northwest, the same situation as BSA. We have not begun the booster shot yet.
Thank you.
If I could, this Dr. Gonzalez again, the important thing to remember is the booster right now is only for Moderna and Pfizer. So because we have the Johnson & Johnson vaccine, I just want to make clear that it has not been approved for any booster. It's just the Moderna and Pfizer, and we only carry the Moderna here at the VA of those.
Makes sense. Okay. And Casey, what are the positivity rates on this testing at the city?
So we're at 38% right now. So a little higher than the general, we have,
gotcha.
You have to have symptoms to be tested.
And I'm backing up because you answered some of these questions. Who is doing the contact tracing for the city right now? Is it health department employees, or did you recruit some more people?
So both. So we have public health staff, and we also have some temporary staffing still.
And doctors at the hospitals, are you finding that you have to divert ambulances, or are you kind of hanging in there so far?
So we have been on some level of diversion almost continuously for the last couple of weeks. I think today's the first day we're really on less, but yes. Now the problem is when both hospitals are on the same level of diversion, then it's almost as if neither hospital is on any diversion. So again, we're doing our best to try to split the ambulances safely and fairly. But yeah, so in that sense, we've had to protect ourselves by asking ambulances not to come to us if possible.
Yes, it's just as Dr. Weiss said, we have had to intermittently go on diversion just because of the inundation that the ER is receiving in terms of ambulance traffic. But as mentioned, when that happens and both hospitals are on diversion, then we divide the workflow, evenly. And we've also, during the previous pandemic, tried to do that outside of diversion, and we may need to go back to that again. We've been talking about that as potential as well.
Okay. And Casey, there's a lot more tests being reported on the report card than the city is saying that they're doing at their site. So what are some of the other busy sources of test results?
So that's mostly the drive-through testing site. We're just we don't get the test results back every day. So, there's we may do 50 today and 50 tomorrow. And so we're waiting for those test results to come back. So there's kind of a cycling effect. And so the pending test results are those that are done through the drive-through.
Okay. I guess lastly, of the doctors, what's the RSV situation here locally?
We're continuing to see a lot of RSV as well, mostly pediatric patients, but some that are not pediatric. High rates of RSV. It's a suggestion, I would say, that the potential for us to have a more severe flu season certainly is about to be upon us, especially with a reduction that we've had in masking requirements. That's why we're all recommending masking, because we're very concerned about multiple respiratory viruses taking place at a time when the risk is going to be significant for our citizens.
Yeah, I would say the same thing. It was just been stunning to see RSV during the summertime. I mean, that's very unique. And then when we run these large respiratory panels, we're also seeing parainfluenza virus, rhinovirus, and enterovirus, and then some of the old-fashioned coronaviruses that we know have been coming through. So, already it's been a fairly busy upper respiratory infection year, and I'm a little worried about what we're going to see, as Dr. Lamentier said, going into the fall with flu hitting us and RSV coming back with a vengeance, and it could possibly be a busy fall into winter.
I would also go in that we sometimes see kids with more than one virus. So I actually had 2 patients admitted last week that had both RSV and COVID. They were older than what the typical RSV patient would be, requiring oxygen. It may have been, and I don't have a way to prove this, but it may have been that if the patient only had one of the illnesses or the other, then they might not have needed to be hospitalized. But with both of them, they ended up requiring the oxygen, having to come into the hospital. So again, yet another reason that if we can all get our masks on, it's going to be able to help not just with COVID, but with these other respiratory viruses as well, because all of those drain resources and obviously put kids in harm's way.
Okay, that's everything. Thank you all.
Thank you, Kevin. This concludes today's news conference. I want to offer a quick reminder that Texas State University System is hosting a Zoom virtual community town hall meeting. It's today, 12:30. It's called This Is Your Shot, Vaccine Facts and Science. If anyone needs information on that, you can contact the Texas State University System, or you can contact the City Communications Office. We can point you in the right direction. I want to thank all of our panel members who participated today in providing this information to the community. Thank you very much.